Okay, so have any of you heard the commercial where the lady says, "Help, I've fallen and I can't get up"? I think it's for Life Alert. So when you think about "help, I've fallen and I can't get up," think of stress incontinence here. Stress incontinence is where things are falling down. So and they can't get back up unless you surgically lift it up. Stress incontinence, you've had a lot of kids, you've even had one child, because think of all of your organs are falling and because we're really only held up by ligaments. So "help, I've fallen and I can't get up." There's another video that you should have watched in my home. This is going to be very quick. Just the most common. Urge, overactive bladder. I gotta go right now. Have you heard of that Enablex commercial? That's an antimuscarinic medication to help reduce bladder spasms. And I think of overactive bladder, gotta go right now. You have to go quickly, and it's usually a brain talking to your bladder and vice versa issue. When I think of overflow incontinence, I'm thinking the bladder is filling up and urine can't come out because there's probably some kind of obstruction for some reason. So many times when people have pelvic surgeries, sometimes abdominal surgeries, think about the prostate surgery, there can be a little obstruction going on, and so things can back up. That's called overflow. And so when the patient gets up to try to urinate, they're only urinating small amounts, but they feel like they have to get up every 5 minutes to go. So it's not necessarily an infection, although we probably will check for that. But we have to look at the whole picture, like what's going on. This patient's, 2 days post-op, and they're getting up to the bathroom every 5 minutes and just feeling uncomfortable. What do you want to do? Well, maybe their bladder's full, so let's get the bladder scan and see what's going on, and let's get them catheterized. So when you're thinking about stress, urge, overflow, look at the whole picture. Obviously, as you keep going, and as you probably already know, that history is so important, and to talk to the patient, get to know them, and figure out what your nursing priorities would be once you figure out a good history and what we think is going on. Some nursing things that we can do for urge incontinence is tell patients to wait 15 minutes if they're having that urge in the middle of the night. Many times it'll go away. A lot of it is psychological, but sometimes we have to move to medications, as mentioned in my video. Stress incontinence, if it's mild, sometimes they can do Kegel exercises, but usually that doesn't do the trick, and they have to end up having surgery to lift the bladder. They do vaginal taping, or sometimes the uterus is falling down as well as the cervix. It's called a cystocele, and we will end up doing it's called a sacral colpoplexy. There's different terminology for it. All right, so just understand those. Go back to the video that is posted in the module and let me know if you have any questions. Thank you.